Hi, this is Dr. Ami Bera, your representative in Congress. Thank you for joining us on tonight's telephone town hall. Tonight, on the first part of the town hall, we'll be joined by Dr. Olivia Kasirye, who's our county public health officer, and she'll give us an update on how COVID-19 is doing here in Sacramento County, vaccine availability. And we've had a couple of questions that were pre-submitted that she'll be able to talk to us about, with regards to vaccine availability, et cetera. Also, I'm happy to take your questions to talk about the American Rescue Plan, how we get our communities open again, how we get our kids back to school safely, as well as how we get people back to work. So, want to hear from you, and this is one of the best ways for me to stay in touch. If you have a question that you'd like to ask me, go ahead and press 0 at any time, and you'll get in the queue. And, we've got about half an hour this evening, so we'll try to get through a number of questions. But if we don't get to your question, certainly we will get you an answer. So, again, thank you for joining our telephone town hall this evening. We're going to give it, we're calling it to about 70,000 households, so it's going to take a few moments to get everyone on the line. But if you've got a question for me, go ahead and press 0. Again, I'm honored to be joined by Dr. Olivia Kasirye, who's our public health officer and in charge of the COVID-19 response. She's going to give us an update on what's happening with the pandemic here in Sacramento County, as well as, questions about vaccine availability, et cetera. And then we will get into some of the questions that are being submitted. Right before we start taking questions, et cetera, let me go ahead and do a survey question. And again, before we do the survey, if you have a question that you want to ask me, please press 0 at any time, and we'll try to get to as many questions as we can. But let's do a survey question, and by participating in the survey, you'll join my email listserv, and that's the best way for us to get the latest updates to you. Here's a question. We're going to talk about building infrastructure and so forth, and I'm curious as to how the folks on the call feel about infrastructure. Do you believe the U.S. should invest in rebuilding our infrastructure? If you do think so, please press yes, 1 for yes, press 2 for no, and if you're not sure, press 3 for not sure. Again, the question is, do you believe the U.S. should invest billions of dollars in rebuilding our infrastructure? Again, press 1 for yes, press 2 for no, press 3 for others. Again, if you have a question for me, go ahead and press 0 at any time. Let's go ahead and get started. So again, thank you for giving us some of your precious time this evening and joining us. As you're a member of Congress, this is one of the best ways for me to stay in touch with you, to hear some of the questions and what's on the mind of Sacramento County residents. In addition, I think I'm like everyone else. I can't wait until we can do in-person town halls and have those gatherings and so forth. And hopefully that's coming soon. But again, the best way for me to stay connected to the people that I work for, the people of Sacramento County, is to do events like this. I'm excited this evening to be joined by Dr. Olivia Kasirye, who serves as the public health officer for Sacramento County. Dr. Kasirye will give us an update on the coronavirus as well as vaccine availability here in Sacramento County. And she and I will answer some questions that were pre-submitted, after which, we'll talk about the American Rescue Plan and, again, how we get our country and our community back to, what was normal 14, 16 months ago. So if you have a question for me, go ahead and press 0 at any time, and we'll try to get some questions. Dr. Kasirye, let me turn it over to you, and if you could give us an update on how COVID-19 is doing in our county, what you're hopeful about, but also, what you're concerned about. And then I know we've got some questions on vaccine availability. Dr. Kasirye, the floor is yours.
Sure. Thank you, Congressman Dr. Bera, for this invitation, and good evening, everyone. So I'll try to give a very brief update in terms of case counts. We are at 99,268 cases reported to Sacramento County and 1,638 deaths. We are averaging about 130 cases added per day, and the 7-day case rate is at 8.4 per 100,000. According to the state blueprint, which determines which tier we are in the red tier, and the update that was given this week is that our case rate was at 9 per 100,000, and that was because of some delayed reporting. We're also seeing a little bit of an uptick due to increased activity and also due to youth sports, but these outbreaks have been very small and easily controlled because we are able to work with the coaches and have the teams or cohorts quarantine, and that usually ends the spread of disease. This week, the state did make two very important announcements. One was that we did reach a very major milestone of 4 million vaccinations given in what we call the health equity quartile. And this is to the underserved communities. And as a result of that, the threshold for the orange tier, which we are aiming to get to by the end of this month, the threshold was changed to 6 per 100,000. So we just have a few more points to go, and we're hoping that we will be able to get there by the end of this month. The other announcement that the governor made is that if the hospitalizations remain low and if we continue to have increased access to vaccinations so that by the time we get to June, anybody who is eligible can easily get an appointment for vaccination, that on June 15th, we will end the blueprint, which will mean that at that time, we will end the state's health officer order as well as the county health officer order. We will not completely go back to normal yet because we will still have to have measures such as face coverings and limitations such as the number of people that can be in a room so that we're still able to do the social distancing. But we are very hopeful because the numbers continue to go down. Right now, Sacramento County is in a plateau, but we are hopeful that we will get through this and the numbers will continue to go down so that when we get to June 15th, we will be able to realize the announcement that was made. So as far as vaccinations, and I'm hoping that you all have access to our dashboard. We update it weekly, and it shows how many doses we have been getting. The doses are given on a weekly basis, and initially we were seeing an increase from 15,000 to 29,000 to last week we got 33,000. But this week, because of some problems with the Johnson manufacturing, our allocation was reduced to 20,000. So we have several providers that we're working with that set up clinics in different parts of the county so that we can make sure that even those that have access difficulties or challenges are able to still be able to get an appointment. We also work with 2-on-1, so people who are not able to have access to a computer or who have language barriers can call and be able to schedule an appointment. We are focusing public health when we get our allocations. We are focusing on the areas in the underserved zip codes so that we can make sure that even those people who have been hit really hard by COVID-19 have access to the vaccine. So with that, I will turn it back to Congressman and see if there are any questions I can answer.
Great. Thank you, Dr. Kasirye, and thank you for, again, giving us that important update. If you have a question and want to get in the queue, go ahead and press 0 at any time, and we will try to answer as many questions as we can this evening. Dr. Kasirye, we do have a couple questions that kind of fall under this line. Carol in Elk Grove submitted a question, as well as a pre-submitted question from Tricia in Rosemont. Carol's question essentially, and I don't know if we can put Carol on the phone if you want to ask the question.
Hello?
Yeah, hi. Is this Carol?
Yes, it is. Yes.
Yeah. Go ahead and ask your question, Carol.
My question is, my son and I, we basically just want the Johnson & Johnson. It is, he has autism, sensitivity to vaccines, and it is would be the best for him. That's what, we decided. But we are having a hard time finding and getting this vaccine. Is there any suggestions how to set this one? This is the only one we want. We do not want the other two. So how do we go about that?
So what we have done is on our county website, and I will provide the link to the website to the congressman's staff so that they can provide it. But we have a website where we include information on all the clinics that are happening in Sacramento County, and that information includes whether it's a walk-up or drive-through, and how to schedule an appointment. And it will also, when we are aware of it, we're also able to put information on what type of vaccine is going to be provided. So I think if you can, check on that website as frequently as possible, because we do update it on a regular basis, sometimes a couple of times a day when we get additional information, and it will help you to know which clinic you can go to. I also do want to point out that only the Pfizer can be used by youth 16 and 17. The other two, you have to be 18 and older in order to be able to get that vaccination.
Great. Dr. Kasirye, I can never remember websites off the top of my head, but do you know that web address off the top of your head?
It's not an easy one, unfortunately, so I will send it, as a link.
Okay, we will,
Carol,
if you were to, if you're on our email list, and we'll make sure we send that out in our next email update. But if you want to stay on, and you can reach out to my staff, and they can certainly get you that number as well. Our office number is 916-635-0505, and we will try to get you that information and get you that website. There was a pre-submitted question, from Teresa in Carmichael, and Teresa was asking, and I'll put my doctor hat on here, and I'm curious that, it's which vaccine do you recommend, and are the vaccines mandatory? And I'll take the first part of the question. I mean, as a doctor and someone who held the first hearing on the novel coronavirus back in February of 2020, so when we were just learning about this virus, had you asked me 12 months ago if we'd have a vaccine, I would have said, we've never developed a vaccine that quickly. But in truth, this is science and technology and ingenuity and people working together. And I would say that we're blessed to have 3 very safe and effective vaccines that are very effective at preventing severe illness, very effective at keeping people out of the hospital, and extremely effective at preventing death. So I think we're blessed, and this is something we can be proud of as a country, to have 3 very effective vaccines. And I think we may see very shortly a 4th effective vaccine, and the Novavax vaccine coming on the marketplace. So I think we're in a very good position. At the federal level and at state levels, nobody's mandated that you have to get a vaccine. But again, as a doctor, I really would encourage everyone to get any of the three vaccines. And as Carol pointed out, in special circumstances, the Johnson & Johnson is a one-shot vaccine. The Moderna and Pfizer are two-shot vaccines, but they're all really good. Dr. Kasirye, would you want to add anything to that?
I agree with you entirely. The best vaccine for you is the one you can get.
Exactly. And so again, if you have an opportunity to get a vaccine, regardless of which one it is, I would highly encourage you to get that vaccine. We had a question from Robin in Sacramento that was pre-submitted. Robin was asking, what specifically is Sacramento doing to help vaccinate under-resourced and Black and Brown communities? And I can talk about what we're doing at the federal level, but Dr. Kasirye, if you want to start.
Yes, as I mentioned, when public health gets our allocation, we are focusing on the underserved communities. We have 12 zip codes that are in what we call the health equity quartile. These are zip codes that were identified by the state as being in the most underserved communities. And so when we are scheduling our pop-up clinics, we make sure that we are working with community-based agencies in those that are already providing services in those areas, and we work with them. Oftentimes they're going door to door to sign people up, and then we make sure that it's very targeted in the people that are able to get access to these appointments. And we are hoping to get we're hoping to have these clinics on a regular basis. We have maybe 3 to 5 on each week. And as I mentioned on that website, we do include that information. So if you'd like to know which clinics we have, it would be available on the Sacramento County website.
Great, thank you. Let's take a question that was submitted. And if you have a question for me, go ahead and press 0, and we'll try to get to as many questions as we can while we have Dr. Kasirye on here. But we have a question from Reginald in Sacramento. Reginald's asking about the future of the virus. Is Reginald, can we have him ask the question?
Yes, I'm Reginald. I'm Reginald King.
Hey, Reginald. Great.
And thank you for inviting me to be on your program. One of the questions that I had asked earlier is that trying to get people to get the shot, we're going to have to be very meticulous. A lot of people are not afraid of the shot. They just don't want to come and get the shot. So we're going to have to use techniques to encourage them to take the shot. And I'm wondering what kind of suggestions or techniques are you using to encourage those to come off their seats and go get the shot? And then I want to know, once we're taking the shot, is this going to be like the flu shot where every year or 2 years we're going to have to take a booster shot?
Reginald, those are great questions. Dr. Kasirye, let me take a crack at how we're thinking about it from the federal level, and I'd love to hear what Sacramento County is doing. At the federal level, we certainly understand that there are a lot of folks that might be hesitant to take the vaccine because this is a brand new vaccine and brand new virus, but then also may not have great access. So, one thing that we specifically put into the American Rescue Plan was to make sure we would be sending vaccines to community health centers, to pharmacies in communities, but also funding to partner with trusted organizations in many of these communities where you might have folks that have less access or more hesitancy and questions. So churches, nonprofits, and trusted organizations. And my sense is we're starting to see those vaccines get to those pharmacies, get to those clinics, because for a patient who doesn't normally go to the doctor or may not have health insurance, they still may go to the pharmacist and still have a relationship with that pharmacist. And we're actually seeing the pharmacy program across the country being very effective in terms of getting people vaccinated. So, if Dr. Kasirye, if you'd like to talk about Sacramento County specifically, and then Reginald, I'll touch on your second part of your question. Olivia.
Yes, I agree with you that the best method that we have found for being able to convince those that are still on the fence or have vaccine hesitancy or even have questions about the vaccine is that working with what we call the trusted messengers, or people who are already known in those communities, who are already community leaders, who are already providing services, are able to talk about the vaccine and encourage them. We also have a community forum twice a month, where we just talk about the updates and are available to answer questions, and again try to make sure that people know where to look when they are looking for appointments. We are also working with 211 to be able to make it easier for people who have difficulty with getting access to a computer or Wi-Fi or internet access, or who may have language barriers, so that they can get assistance with getting an appointment. And those that have transportation barriers, we're working with SAC-RT, that is providing free rides to a vaccine appointment.
Right. And Reginald, the second part of your question was, will the novel coronavirus, COVID-19, be like the flu, where we have to get a booster shot or a vaccine every year? The truth is, we don't know, because it's a brand new virus. Many of us are preparing as though this could be a annual shot because of the variants that we're starting to see pop up. And I do think, right now the race is to get everyone vaccinated, and the sooner we can get the majority of the population vaccinated, not just here in the United States, but also around the world, the better our possibilities of preventing other variants that aren't not effective by this vaccine. The other question I get a lot, and again, I'm putting my doctor hat on here, is how long am I immune? And that's just a question we don't know just yet, whether it's from the vaccine or if you've had the infection and recovered, how long that immunity lasts. Right now, we feel pretty comfortable that 4, 5, 6 months of immunity. And that's not to say if you have had COVID-19 and you've recovered, we still recommend waiting 90 days, but still getting your vaccine. So that's something that I think is important to put out there, that if you did have a positive COVID test, and you had the infection, we're still recommending people get the vaccine. They wait 90 days after they've recovered to go get that vaccine. Let's take a couple more questions. We've got a question similar to, I think, what we were just talking about, but from Karen in Citrus Heights. Karen, are you on?
Yes, I am. So the first question was if there was an update as to how long the vaccine is good for, and that was basically answered. And then the second one was about variants. Since everybody in my family have gotten both shots from Pfizer, and we're all seniors, 70, 73 to 92, we're still concerned about the variants, and if we go out there, are we gonna get sick?
Karen, that is a great question. Let me touch on the vaccine effectiveness with regards to the variant. Right now, we're lucky. The Pfizer vaccine, Moderna, and Johnson & Johnson all seem to be very effective at preventing severe illness, hospitalization, and deaths from any of the variants. And so right now, I think we're staying ahead of the variants. But none of us knows what the future holds, and vaccines mutate all the time. So the longer it takes us to vaccinate everyone in the United States, but also a large portion of the world, at some point there may be a variant that is a little bit more resistant to some of these vaccines. Right now, I don't think we've seen that. Dr. Kasirye, are we seeing the variants here in Sacramento County right now? I know some of the surrounding counties have seen variant cases.
We have had a few reported. We've been notified of at least 15 cases, so we know that we do have it in Sacramento County. And you do bring up a good point. We do have some concern, and that is why we still continue to ask that even people who are fully vaccinated and protected when they are going out in public, that they continue to use a face covering and take all the other precautionary measures, because we still have a lot of infection circulating, and there are opportunities for the variant. So it's still important for us to continue to be cautious.
Dr. Kasirye, I think you touched on this earlier, but I know back in January and early February, many of us were worried because we were seeing our hospitals fill out the ICU beds and capacity, getting close to capacity. How are our hospital cases doing right now in terms of raw numbers and ICU beds?
Our hospital capacity is good. It's over 20%. And we, in terms of number of hospitalized COVID cases, it's less than 100. So it's definitely dropped from where it was at the peak in December. But of course, we continue to monitor. One good thing that we have going for us right now is that with the vaccine rollout, the initial doses went to the long-term care facilities, because in previous surges, what was happening is when we had the virus circulating in the community, if it got to the long-term care facilities, we started having huge outbreaks, and that would end up with a lot of people ending up in the hospital. So now that the long-term care facilities, many of them have been vaccinated. In fact, we're hearing from several of the facilities that they have 100% vaccination of their residents. So the protection is really good there. And so that has helped to keep the numbers down.
Great. Thank you. We have a question from, I think it's Rejoice in Sacramento. Rejoice, are you on?
Hi. Hi, Dr. Ami Bera and your guest.
Hi.
I have little underlying conditions. I'm diabetic, and if I get upset, I have sometimes respiratory conditions. So, and I have reservations because of that. So should I be concerned about the vaccines, the different type of vaccines, or, like the Pfizer, Moderna, or the Johnson & Johnson, or not to be concerned at all and just, put my worries aside and go for the shot, for the vaccine?
I think it's a great question and a realistic question, and I'll give you my perspective, and then certainly let Dr. Kasirye share her perspective. But given the diabetes and potentially some underlying respiratory conditions, you're at higher risk should you contract the virus of having more severe illness, potentially ending up in the hospital. And in the clinical trials and the studies of all three vaccines, they've all been shown to be very safe. They don't give you the disease because of how the vaccines manufactured, and they're very effective at preventing severe illness, hospitalization, and extremely effective. And again, I may be wrong here, but I think in all of the studies, no one who's received the vaccine has actually died of COVID-19. So I would very strongly, again, I'm putting my doctor hat on, but recommend that you do get the vaccine because they're all three very safe and effective, and you really don't want to get this virus because we've seen how devastating it has been to so many people in our community and across the country and across the world. Dr. Kasirye, would you want to add anything to that?
No, actually, I agree with what you said.
Great. Thank you. We've got a question from Ralph, or Ralpha in Elk Grove. I don't know if Ralph is still on. Ralph, are you on? No. Ralpha may not be on. The question was, will a booster shot be necessary? And right now it's too early to tell. I mean, I do know our pharmaceutical companies are looking at that and are, preparing to be ready should a booster shot be available, or particularly with some of the variants that are out there. But right now, again, a brand new virus. Right now we're seeing that the vaccines are very effective, and I think part of the reason why we're cautiously optimistic that we might be able to get to some semblance of normal sometime this summer is because of the effectiveness of the vaccine. We've got a couple other questions, and we'll try to get to a few more. And if we don't get to your question, do stay on, and we'll try to get your information and certainly get back to you. We've got a question from Mary in Rancho Cordova. Mary, are you on?
Yeah, hi.
Hi, Mary.
Hello. Hi. I just had a question about the mask wearing. From what I'm hearing, the shots are pretty effective. So I was just wondering, is there any end in sight for the mask wearing, or are we pretty much? And then also, part of that question would be, with the possibility of variants coming through each year, is this just life now, mask wearing, since these variants are possibly going to come through, or is there an end in sight to that?
I sure hope there's an end in sight, because I miss being able to see people's smiles and all of that. But I think, as Dr. Kasirye mentioned earlier, right now, as we're still trying to get everyone vaccinated, knowing that we're seeing the variants, and the variant that came from the United Kingdom, from Britain, the British variant, seems to be now starting to be the predominant variant that we're seeing in the United States. I think it's a time still to be cautious and wear your mask, continue to physical distance, and obviously practice good hygiene. And again, the hope is, if we get to a place where case numbers are really low, you're not seeing folks being hospitalized, and we have sufficient population vaccinated. We're not there yet, so it's still time to be pretty cautious and practice all the good measures that have gotten us. But I do hope there's a day where we don't have to wear the face masks on a continuous basis. Dr. Kasirye, would you like to add to that?
Yes, I agree with you. And yes, we know that the vaccine is very protective. But as I mentioned, we still have a lot of people who are not vaccinated yet. So we still have, for example, in Sacramento County, it's still a substantial transmission ongoing in the community. So we still need to follow the guidance and continue to use the masks. We do hope, and especially if we look at what's happened previously with previous pandemics, that there'll come a time where they will be able to control this and we'll be able to get to our normal lives. But we don't want to try to do that too soon, because if we do, then there's the risk of getting another surge. So we need to just hang in there for a little longer, and definitely we continue to update as we see what's happening with the numbers, and I'm hoping that it will happen sometime.
Great. Let's take one or two more questions. And again, Dr. Kasirye, you've been generous with your time. We have a question from Yolanda in Sacramento. Yolanda, are you still on?
Hi, doctor. Thank you for taking my call. I'm African American, and I guess my concern is that I know a lot of people in my community have concerns about the viruses. And then with all the new strains, you just don't know which one to take. And I hear you say that, anyone is okay. Obviously, a person would want to take one shot over two, and I don't know that there's enough of the Johnson to go around for people that would want to only take one shot. But I guess the concern is that what can we do to maybe help people? Are there any programs where you can go to their home? Sometimes people might feel a little bit more secure if you can come to their home and just maybe do it on their porch. I'm saying do it on their porch if they don't have transportation. Are there any services that are out that are willing to do something like that, especially for people that are in rural areas, one? And then two, what can we do to help people to feel like that we really should take this vaccine? Because there's rumors going around that even if you get the vaccine, you can still get COVID, or you can still spread the COVID. So there are people who feel like, well, what's the point of getting it? I haven't had the vaccine yet, and I haven't gotten COVID, so why go get the vaccine if I could still get COVID after getting the vaccine? So there's just so much confusion out there, and I know that you guys are doing the best, and not you specifically, but the whole, the people are doing the best they can, to try to get the information out there, but it's so very confusing. And
Yolanda, your questions are great questions. First off, I think you're right on. For a lot of Black and brown communities or less resource communities, to ask someone to take several buses and go to a mass vaccination site doesn't make sense. So I know we at the federal level, we've been pushing vaccine out, want to try to bring the vaccine to those communities, which is why we started the pharmacy program to try to get vaccines directly to pharmacies, but also to empower the counties, and Dr. Kasirye can expand on this, but to have pop-up clinics, mobile clinics, to try to bring the vaccine to where folks are. And then for folks that may be a little hesitant to take the vaccine, part of the reason why we want to partner with trusted individuals, whether that's clergy or a nonprofit, or often, people trust their own doctors. So, working with those trusted groups within these communities to allow them to answer the questions and deliver the message and work with us to get those vaccines to folks. Dr. Kasirye, are there specific programs in Sacramento County that are bringing the vaccine to people, whether it's at their home or certainly in their community?
So we have a program that where we can actually have the nurses go to a home, but we use this for homebound individuals or individuals who have great difficulty with, have disabilities that make it difficult for them to leave their home. But otherwise, for others, as you've mentioned, Congressman, we are the reason for setting up these pop-up clinics is we're having them in the community to make it easier for people to actually be able to access the appointment.
Well, great. Dr. Kasirye, you've been very generous with your time this evening. And again, thank you for your service to the residents of Sacramento County and helping us get through what's been a challenging 12 months. But again, if we stick with this and get our vaccines, continue to practice safe practices of wearing a face covering, physically distancing ourselves and practicing good hygiene, I do see a light at the end of the tunnel and a day where we can feel like we're getting back to some normalcy. So, Dr. Kasirye, again, thank you for joining us this evening.
Thank you for having me.
You're welcome. For those that are still on the line, I thought I would just take a quick second to talk about the American Rescue Plan, which is this piece of legislation that we passed last month and the president signed into law. The real impetus behind this piece of legislation was, one, as we've just been talking about, to get vaccines out as quickly as possible. And we're now over 3 million Americans a day are getting vaccinated. And I'm optimistic that if we use the might of our ingenuity, we can get to 4 million vaccinations a day, which will help us stay ahead of these variants. It is a race against time. In addition, we heard from local communities, Sacramento County, Fair Oaks, Rancho Cordova, Elk Grove, others, about the real impact on their ability to serve the people that live here. So there's resources in there that will go directly to some of the cities like Citrus Heights and Elk Grove and Rancho Cordova and Folsom to really try to restore some of the services that have been cut. In addition, we're going to continue to work and support small businesses to try to get people back to work. And then the other big thing in here is funding to get our schools open again. I'm very empathetic with regards to the families that are trying to work, but they also have school-age children. They're trying to teach their kids at home, et cetera. Our kids have been impacted by this last year of education, so we've got to get them back in the classroom, but we've got to do it in a safe way that protects the kids, but also protects their families and the teachers and the staff. So I'm happy to say that we have been prioritizing getting school teachers vaccinated, and again, it's gratifying that a lot of the districts in our community are starting to have elementary schools back in classrooms, and hopefully soon we'll have every student back in a classroom. So the other piece that is the housing challenge. A lot of folks are having trouble paying their rent, et cetera. So again, continuing to help those folks, with their rent, but also the landlords that are often mom and pop landlords, pay their mortgages, et cetera. So, I could take. I'm going to have to hop off in a second to go attend a city council meeting, but I can take one or two more questions that are non-COVID related. And again, there's a question from Anthony in Elk Grove. Anthony, are you on?
This is Anthony.
Yeah, hi, Anthony.
As a military veteran, to serve in the military, I was sworn to protect this country against foreign domestic enemies. Those veterans that stormed our holy place of democracy, are they being held accountable?
Anthony, thank you for your question. I was on January 6th. I was at the Capitol, in the Capitol complex, and I don't think any of us realized how bad it was. And then when you look at the footage, and more and more continues to come out, this could have been tragic for our country. Given what the intent of what they were doing. But directly to your question, yes, it's our expectation that the Justice Department, the FBI, will fully pursue and implement the law here. So whether it's veterans, but also others that broke the law. And again, the intent was pretty clear. They wanted to disrupt the certification of the election. So yes, the short answer is yes. I think everybody, if we want to be a country that's a rule of law, we have to uphold the law and hold people accountable. So thank you for that question. And Anthony, thank you for your service to our country. We've got a question from Donald in Folsom. Donald, you're on. Donald, are you still with us?
Thank you, Congressman Bera. My question is about voter suppression laws that appear to be being looked at throughout the country. And I wonder if the First Amendment guarantee of the right to peaceably assemble overrides such as the Georgia law that says you can't give someone a drink of water while they're in line.
Yeah, Donald, thank you for that question. I mean, I think a lot of us are concerned about, some of these laws that are being passed to make it harder for folks to vote. We should actually be doing the exact opposite. We should be making it easier for people to vote because the core to our democracy is an individual's right to legally cast their vote. And in democracy, your vote is your voice. And, when I look back on the presidential election that we just had on November 3rd, I actually think we can be proud of our democracy. I mean, this was a very heated contest, hard fought, a lot of rhetoric on both sides, but we saw record turnout, record numbers of people coming out to vote, particularly young people casting their ballot and, communities of color that don't normally come out. And, record numbers turned out for Donald Trump, record numbers turned out for Joe Biden. And this is the most transparent election we've ever had, where you had multiple court challenges, you had requests for recounts, and anyone who says there was voter fraud, that's not true. That this was a very fair election, hard fought, and it was democracy in action. So it really worries me when I'm seeing certain states enact laws that make it harder for folks to vote, because I think we should actually be doing the exact opposite. And folks, can still win their elections based on their ideas that they're running on, and that's how it should be. Even here in Sacramento County, we saw record turnout, and that is good for the future of our democracy. We should run on ideas and how we hope to help the citizens and the people of this country. So, I am going to have to hop off. I know we've still got a few folks that are on that have questions. And again, I really do appreciate your giving up some of your time this evening to be on our telephone town hall. Again, the best way I can serve you is by knowing what your concerns are and what's going on. So please always do feel free to reach out to my office. And our website address is Bera, BERA .house, HOUSE.gov. That's Bera.house.gov. And you can go to our website and, if you have a question, we're here to try to help you. You can also call my office at area code 916-635-0505. That's 916-635-0505. Thank you for, again, giving us some of your time. This has been a tough year for all of us. If we stick together and look after one another, I do feel confident that there's light at the end of the tunnel. Again, be safe, be kind to one another, and be well. Have a wonderful evening, and thank you, and God bless all of you. Be well. Good night.